National Wear Red Day, in case you haven't noticed, a day to raise awareness about women's heart health. Cardiovascular disease is the #1 killer of women in the U.S., and today we are taking a closer look at sudden cardiac arrest. Dr. Tara Narula has the story of one woman who says CPR saved her life.
Happy birthday to you.
Celebrating another year of life is something Jenny Lynn Carpio does not take for granted. In 2005, she almost died.
I was 22 years old when I became a new mom. I was a new wife, and I was a college student.
Jenny Lynn was visiting her mother, Jocelyn, with her then 2-month-old daughter when she decided to take a nap.
And next thing I remember, my mom frantically pumping at my chest, yelling at me to wake up. A police officer was shining a light in my eyes, and my mom had said that you just experienced a sudden cardiac arrest.
Jocelyn was trained in CPR, but she never expected that she would use it to save her own daughter's life.
Seeing my daughter being that thing is kind of scary.
About 90% of people who suffer out-of-hospital cardiac arrests die, but performing CPR more than doubles someone's chance of survival. At the hospital, doctors discovered Jenny Lynn had an undiagnosed genetic heart condition that can cause irregular heart rhythms, putting her at risk for sudden cardiac death.
I was shocked. I had to process that this was going to be a lifelong thing.
Surgeons implanted a defibrillator in Jenny Lynn to detect and shock her heart when abnormal and dangerous heart rhythms are detected. She has now had 4 defibrillator replacement surgeries, the most recent in 2020. With this device, Jenny Lynn is living a near normal life and using lessons learned from her own experience to bring awareness to sudden cardiac arrest and the importance of CPR.
What I would like other people to know in regards to sudden cardiac arrest is that it can happen at any time to anybody, and that knowing CPR is a life-saving skill. And that is why I'm here today.
And Dr. Tara Narula is here now to talk more about heart health. Good to see you.
Good to see you. It's my favorite day of the year.
Yeah, I know. We've been talking about this like in anticipation of you coming on to the show. So let's begin with the warning signs of cardiac arrest. For men and women, what are they?
Well, not many, actually. So that's why we call it sudden cardiac arrest. So many times there are no warning signs, which is why it's important to know what are the risk factors that could cause you to have a sudden cardiac arrest, number one. And number two, what do you do in the event that someone has it, right? That's really the important thing. However, in some cases, there can be warning signs, and a lot of people tend to maybe downplay them or minimize them, and we try to educate, don't do that. So if you have chest pain, shortness of breath, if you've passed out or had lightheadedness or even heart palpitations where your heart's skipping or fluttering, these are things that you should really bring up with your doctor, maybe see a cardiologist about. It doesn't mean that that is a warning sign, but it certainly could be. So important to pay attention to your body and speak up.
So then what's the difference between sudden cardiac arrest and a heart attack?
This is such a great question, and I feel like there's a lot of confusion out there about that. So a heart attack is like a circulatory problem. You know, the arteries that supply blood to the heart muscle can get blocked, and because they get blocked, no blood gets to the heart muscle cells die. That's a heart attack. Sudden cardiac arrest, on the other hand, is an electrical problem. So essentially, the electrical system of the heart becomes abnormal. You develop an arrhythmia, an irregular heart rhythm. And so instead of pumping, the heart essentially stops pumping because the electric system fails. No blood gets to the body, to the brain, to the organs, and so that's why you lose consciousness very quickly. And unless you really do something about it, you can die within minutes. So it's like a pump failure. Sometimes heart attacks can cause sudden cardiac arrest, but they are definitely two separate entities.
So who's at risk for sudden cardiac arrest, and what can people do to reduce the risk? Because, you know, there are some people who, when we were talking about this earlier, who might have a symptom that is, and turns out to be heartburn, but they thought they were having a heart attack. Or I've had moments where, this is going to sound crazy, but like, you know, you get up very quickly in the middle of the night to hit the bathroom, and all of a sudden, while you're using the bathroom, you get lightheaded and you feel like woozy. And I had to research that because I was like, was I having a heart problem, or was it the pressure of urinating and like standing up very quickly.
Or the sore arm. You always hear about the sore left arm.
Right.
You know, yeah.
There's a lot there.
Yeah, a lot there. So, especially on this day, we educate women who tend to not prioritize their health and, prioritize their symptoms to paying attention, right? So the first thing is if you do feel any of these symptoms that I mentioned, you want to get it evaluated. Don't just blow it off. And it is sometimes hard to know, is it heartburn or is it your heart? You really need to get evaluated for that. The second thing is to know your risk factors, which you asked about. And so what's interesting is that sudden cardiac arrest usually happens in the setting of some underlying structural heart disease. Most often, 70%, it's coronary heart disease, so the type of heart disease that causes a heart attack. And what you can do is the same risk factors that we talk about to prevent heart attack, controlling high blood pressure, diabetes, weight, exercise, not smoking, avoiding too much alcohol, looking at your cholesterol numbers and making sure they're in line. Those are the same things you can do to lower your risk of sudden cardiac arrest. The other remaining 30-40% is either structural heart disease that's related to the heart muscle. So the heart muscle is scarred, dysfunctional, thickened, or there's something you were born with, maybe with your blood vessels that is abnormal. And then the last kind of 10 to 15% is some electrical abnormality with the heart, like in Jenny Lynn's case, she had a genetic condition that predisposed her to an arrhythmia. And there are some of those, we call them Wolff-Parkinson-White, long QT syndrome, which she had, Brugada syndrome. So there's some of these electrical conditions.
She didn't know that, though,
And
right?
she did not know, because you wouldn't necessarily know. And that's why the last thing that we talk about is knowing your family history. So you can know your risk factors. You also have to talk to your family and say, do we have a family history of sudden cardiac death or heart attack, early heart attack or stroke?
We're sort of running out of time, but I know we have to talk about CPR.
Yes.
Because tell people how important it is to get trained up, know this stuff.
So it is so critically important. I mean, imagine you're there and someone you love is down on the ground. You do not want to feel frozen, and you should not. You are empowered. So learning hands-only CPR, you don't have to give rescue breaths, is just as effective as doing the type of CPR with breathing. It's basically call 911, get down on the ground, and push hard and fast, 100 to 120 beats per minute in the center of the chest. Think of the song Staying Alive by the Bee Gees. That's your rhythm.
Staying alive, right.
And then if you have access to a defibrillator, don't be afraid to use it. It's so simple. Take it off the wall. It literally walks you through step by step what you need to do, where to put the pads on the chest, what button to press, and you can save a life. I mean, 90% of people who have an out-of-hospital cardiac arrest are going to die. However, if you can give CPR, you can improve the chances of survival before EMS gets there to give CPR, and you improve the chances that they're going to have a good neurologic outcome because you're giving blood to the brain. And important, 3/4 of these happen at home. So again, the importance of doing this for your loved ones.
Yeah. Dr. Narula, thank you so much.
Thank you, Tara. As always, such important information for people out there. We appreciate it.
Thank you for supporting Go Red.
Of course. Like, I got my little pin, got my red tie. It's hard for men, because I don't have a red suit. But
Well, I got to put that on the list.
I put that on my Christmas list. All right, so to learn more about how to properly perform hands-only CPR and use a portable defibrillator, let's say that word, defibrillator, go to the CBS Mornings Facebook, Twitter, and Instagram pages, or cbsmornings.com. You can actually watch a demonstration with Dr. Narula and an American Heart Association trainer.